So today I want to talk about lateral hip sliding, okay? So kind of where we see a lot of the hips kind of move side to side quite excessively in the golf swing. I want to talk about potentially why, or one of the main reasons why that might occur, and how we could almost measure that from a physical perspective. So kind of what I mean more from a golf swing point of view is if we're lacking in one of the hips, if we're lacking mobility, specifically what we're going to talk about today is hip internal rotation, for a right-handed golfer, we'll probably see when they take that club away in the backswing, we'll probably see this right hip have less rotation, so that right hip going backwards, and see more of kind of like pushing away. So an exaggerated version would be that kind of motion. So kind of if we're pushing that way, we're coming away from the center point, and at the top of the backswing, because we've not rotated, the chances are the upper body will either go this way, so kind of almost tilt reverse C, or the opposite way, where it's come a long way off the ball, and obviously making contact with the ball is going to be much harder. Whereas the main one, or the main common we see, is in the left hip, and this can still be a cause of the right hip, but obviously in transition, so what golfers and golf coaches refer as the weight shift, something more precise would be the pressure shift. So when transition, when we start that downswing and start to push into the left foot, to the left hip, this left hip doesn't rotate out of the way. Instead, it starts to slide towards the target because there's a lack of mobility in that hip. You'll see quite a flexed left knee because, again, if that left hip isn't turning, it won't be able to straighten very well. And two things that tends to kind of see as a result, it's a byproduct, it's a compensatory movement, is if that kind of position there, people will try and stay down on it and try and, so there's a lot of kind of fat motions, there's a lot of almost loss of height, or secondly, the most common one, which links into early extension, is obviously when that starts to go that way, if we're going to still kind of come in quite shallow, we're then going to have to kind of almost lift up out of posture. So we kind of go there. As a result, we have to come here. So a really simple drill and exercise I'm going to give you today is for you at home to measure your hip internal rotation mobility. Now, we want to note to begin with that your hip internal rotation can be limited down to a number of different reasons that isn't just down to a lack of flexibility in general. If you've had a knee or hip operation, naturally you're more likely to be limited in your hip mobility because there's been trauma there, and also your probably range of motion and your natural ability to move through that joint or those series of joints is going to have been affected depending on the type of rehabilitation you've done. We also want to make sure that when we do this exercise, we're actually doing it correctly where we can measure it effectively. But it also might mean that you may lack hip internal rotation and not show these swing characteristics, and vice versa, you may not lack hip internal rotation and show swing characteristics. That's really normal. This isn't my way of saying you lack this, you will do this, like there are some claims out there, but what it can start to show is if there is a physical limitation within your body, the chances are you're going to have worked your golf swing around that motion to make it functional for you. Start on the floor with your feet as wide apart as you can get them. We want the feet flat and we want the knees pretty far back, so pretty flexed, okay? The key is to try and get them as wide apart as you can without having them too straight. From here, we want to keep the upper body still. So the hands want to stay pushed into the floor, and you're going to simply bring one knee down to the ground. So what I'm doing here is internally rotating my knee, and as you can see, I've not moved my upper body. So as I come down, I don't want to see you compensate and rotate out of it to get that fuller range of motion. I want you to simply just try and keep stable through the upper body and the core, hold it at the floor for 2 seconds, and repeat. So what we'll most likely to see with some of you is you'll get halfway and it will feel like you cannot go any further without moving. You'll feel restricted in the hip, quite tight in these sort of areas. This is quite common, so your challenge is to build this up over the coming weeks. So we want you to try and be able to get that extra range of motion as we get more mobile through the hip, and we want to try and feel like we're getting more freedom in there on a consistent basis. So your challenge is to do this every day for the next 3 to 4 weeks. I want you to do 10 repetitions on each side with a 2-second pause at the bottom, 3 times over. Report back to see how you get on.